I'm Jamie Laughlin. I'm Director of Volunteer Services at Unity Health. Our auxiliary has definitely been a blessing to this hospital, not only through the hours of service that they dedicate, but also to the relationships that they build with the associates and also with the patients. It may be short-term with patients, but it sure is meaningful.
My name is Kathy Gamble, and I'm a volunteer. I have been for almost 14 years. I work in admissions. I greet patients when they come in and help them find where they're going. Volunteering is a very rewarding experience because it gives you an opportunity to help others. Sometimes we go into volunteering thinking that we're just going to help somebody else. But we help ourselves when we do that as well. And not only that, we have an opportunity to assist the associates to do things for them, and we just have a big, happy family there.
I'm Gail Sills. I've been a volunteer for 5 years.
And I'm Sandra Sills, been a volunteer for 4 years.
I had a friend that was a volunteer, and he and I got to talking, and at the time I had just retired. I was looking for something to do. Well, I'm a chaplain, a messenger at the admissions desk and materials.
I take a cart around to all the departments and make sure that they have the hand sanitizer and Kleenexes for patients and visitors to come around. I enjoy being a volunteer because I get to meet other people, and it gives me a reason to get out in the morning. And once you get out in the morning, you find that life is worth more. And I love talking to the people and interacting with them.
Walking down the halls, you can always tell somebody that's lost, because all those halls look alike, and and just being able to say, "May I help you?" And they look at you and start smiling because somebody cares. And I have never failed to get a thank you.
My name is David Crouch, and I've been a volunteer chaplain at the hospital for 22 years. Anytime you serve, you're blessed, and I'm blessed when I'm at the hospital serving there, and it is a blessing for me. And I know that people have said, "I'm glad you came."
My name's Dennis Ryan. I'm a teacher, coach, guidance counselor at Harding Academy. My parents are Floyd and Patty Ryan. They work in the auxiliary and volunteer at the hospital. Mom works in the gift shop. Dad helps take people to their rooms. I think it's a great thing that they're working at the hospital. My parents' volunteering has helped relationships not just at the hospital, but outside the hospital as well. My parents have always been active in community, in whatever community they've been, and them coming to Searcy, they've been able to continue service in the community and connect with people. And so the hospital's given them that opportunity to continue to serve.
Normally, our shifts range from 3 to 4 hours. We have some volunteers that give 1 shift per week, and we have others who give 3 and 4 shifts per week. You can work in the same place and give at the same avenue of service, or you can do multiple avenues of service. We have many jobs here in the hospital for volunteers to do. We have volunteer desks that they can man and help guests to find the rooms. We also have escorts that will see people to the correct place. And we have materials management, which is where they help that staff to put stickers on every single item in the hospital. We also have messengers who pretty much run the veins of the hospital and take paperwork back and forth or anything that needs to be done. And we also have vendor sales such as linens and sheets, clothing, and different items, cookware. And we raise a good amount of money, but the majority of money that is raised is through our gift shops. The gift shops have enabled us to be able to really, truly make some abundant donations through the foundation. We were able to help with a cancer center conference room. We were able to help with the New Life Center. And it's just been a good feeling to know that all of their hard work and all of the money that's earned is put to good use for our community.
The friendships that I've formed volunteering have been a true blessing in my life. They've been there as my family, as my extended family. They've shared the fun times with me. They've shared the sad times with me. As you start to think about other people, as you think about what they're going through, and as a volunteer, you want to help those folks. You want to make things a little easier for them. You want to provide them a little bit of an opportunity to see that even though we as a volunteer can't make the situation right, we can at least help them through it.
The volunteering at the hospital has really encouraged my parents to stay active in their retirement days and as they get older. It's very encouraging to see them still being a vital part of the community and continuing to make those relationships that are part of the community. As you go out to church, as you're going to Walmart, out shopping, they continue to make connections with people. And I think, the hospital's obviously about taking care of medical needs, but it's also taking care of relationship needs. And continuing to grow those relationships is vital for them as they continue to grow older.